Welcome to the fifth episode of Healthcare Matters. My name is Hesham and I lead Roche team in Bulgaria. And during this podcast, we discuss key issues that impact the healthcare system in Europe and how we can provide a better care for our patients. Today, I'm delighted to be joined by Oliver Bleck, Area Head of Roche Pharma in Europe South. Welcome, Oliver. Thank you so much for joining us today. And let me jump straight into it. You know, Oliver, that there is a real concern today about healthcare in Europe. We see increasing demand. We see real pressure and change in terms of demographics. What are your reflections on this challenge and what can we do about it?
So thank you, Hesham, for having me, and I'm excited to discuss. I share your concern around the state of healthcare. If we were to examine healthcare in Europe, it's not in a good stage. I would even say it's in some parts of Europe in crisis. We have the legacy of COVID. We have the demand on increasing costs, and then the challenges that societies face with an aging population, the cardiovascular death, and then the rising cancer rates, just to name a few. But before we get into those challenges and real concerns and what we need to do about urgently, let's pause a moment and also reflect where European health actually could be.
What is the desired state, Oliver? Yeah. What is your vision for a healthier Europe in the future?
Yeah. So I think if I look at, my experience as a caregiver, as a citizen, but I've also been for many years a clinician, and now working in the life science industry in pharma for Roche, heading up commercial operations in Europe, I've seen challenges, from various perspectives, and I can sympathize with those. But let's bring this back to the vision. I see great talent, across the industry, but also healthcare workers, a strong footprint that we have in the life science industry, strong partnerships that we have with academia, a legacy of research and development in Europe. So we have strong components together. And in fact, a lot of today's innovation for the world still comes from Europe. That's one part. However, we also have to realize, and here's the concern bit, that this innovation doesn't reach European patients in the same pace like the US or in Asia. And in fact, in Europe, we have countries where you have to wait for cancer medicine 3 years, while in other parts of Europe, it's available on the day of regulatory approval. And this we cannot accept in Europe anymore. So my vision is to come to a state of a much healthier Europe moving forward, where we embrace the science and the technology that we have in our hands, have the right policies in Europe in place so that we can bring innovations to patients faster, and that we have a system where we can have access to data that helps systems to be much smarter on where to put the funding, where to allow innovations to come in, and also to take out things that don't work. And I think that's my vision moving forward. But it's an important question we need to address right now, because the time is ticking and the challenges are rising. If we don't address them, especially in the light of the window for policy changes in Europe that we have at play, we miss an opportunity and Europe will fall behind.
Indeed, Oliver. And you spoke a lot about innovation and technology and how they can help to address some of our challenges. And in our sector, we speak a lot about innovation. On the other side, when you speak to many of our policymakers, they are really more concerned about some of the key challenges they are facing today. There are workforce challenges. There are issues with the capacity of the beds. There are waiting lists of patients. Do you think we are able, as healthcare industry, we are able through innovation to address some of those infrastructure issues?
Definitely. I think we have been a strong partner to the system, and I think also other stakeholders. One thing I would want to call out is for these challenges and real problems that you are mentioning, we got to work together. And I think at Roche, the example that comes to my mind is if I see a full waiting room for cancer patients, for example, I think we have delivered and innovated a curative medicine that you can apply via a subcutaneous formulation. Meaning, as a patient, you don't need to sit hours in an infusion chair, but your therapy can be administered in minutes. So you can just see, bringing this innovation, cure, and also the way, it's applied, will just help to free up capacity in the hospital. And let me ask another question. However, will we solve these challenges if we don't rely on innovation or if we don't rely on technology that we see in other parts of the economy and our daily lives? So patient flow management, better procedures, technology and science, I think if we bring it together, will help address these challenges.
So innovation on one hand, and definitely partnership and collaboration.
Yes.
Indeed. And let me ask you again, but innovation, as you know, Oliver, comes with great cost and with great risk.
Yeah.
In your perspective, how healthcare innovation should be assessed?
If your cancer can be treated early, detected early, treated early, and you can go back to work and get on with your normal life. It's very straightforward if you think about this from a patient perspective. So actually, I think the real question is, what's the value of health? And we tend to forget what this means. And I think we may have experienced this ourselves or with our friends. I certainly have in my career that the gift of health can be taken away overnight. And I have this image I carry with me when I was in charge of melanoma clinics in my career. I had this patient who was my age, and he was diagnosed with advanced melanoma. And back then, some two decades ago, we didn't have much to treat effectively. So the cancer would grow and the patient unfortunately died. Now, seeing the progress in science and seeing what we can do now, it's a very different approach. I could see this patient now, I had better diagnostics, I could give an effective therapy. And today we know we can not only stop this cancer from growing, but also provide a perspective and hope for these patients to live longer and eventually, hopefully, even being cured. And that's, I think, the great progress that we see in science. And the unfortunate truth in Europe, unfortunately, is in some areas you will have access to the medicine with regulatory approval. And in other parts of Europe, you have to wait 3 years or even longer to have access. And this we cannot accept anymore in Europe.
So equity is very much needed for our patients across Europe.
Yeah.
Equity in access, in care, as you mentioned. And that definitely will need a health policy that really assess fairly healthcare innovation and to assess this innovation timely. And that will take me to my next question, where I'm really curious to know your reflection on some of the key health policy dynamics in Europe. And let's start with the health technology assessment regulation that will go into force by January 25.
Yeah, that's a very important policy update. And I think it comes with an overarching frame of the European Commission and the EU in itself to focus on health. And this policy update will help to take a very fragmented system that we have in place today to synchronization, to better outcomes with one goal: to speed up, broaden and improve patient access across Europe. So I think that's a really important update in order to accelerate access for patients in Europe to the medicines they need. We're very excited to be working very closely with the governments and the various stakeholders to make it happen. And the call is to everyone to keep the ambitious timeline to make sure we are ready in January 25 to act upon it, because that will expand and accelerate patient access.
So a lot of work on capacity and readiness to make sure that readily we can assess healthcare innovation and provide this needed access for our patients. Another very important dynamic is the pharmaceutical legislation.
Yes.
What would be your reflection on this health policy dynamic as well?
Yeah, it's another very important legislation within the framework of focus on health and providing better health in Europe. It's overdue, and we've been waiting for this change in legislation for over 20 years. So on one hand, it's to update and accelerate the regulatory approval and expand patient access. And the second big aim of this legislation is to strengthen the life science industry and the sector within the EU. This will help expand and also accelerate patient access. And while we welcome the measures towards a faster regulatory approval like we see in the US and other parts of the world, there's also some worrying draft legislation on the table from the Commission, especially once it comes to intellectual property. And the draft that we have on the table now is actually weaken the intellectual property if medicines are not commercially available within 2 years in all European member states. Now, this will actually not improve patient access, accelerate patient access. It will also hinder innovation in Europe. The pharma industry has already made a commitment to file all new medicines for pricing and reimbursement within 2 years of regulatory approval. This information is public, and you can track progress towards these goals and towards the commitment, and as such also hold companies accountable. And while we think about the policy, HTA, pharma legislation, let's not forget that we also have a sense of urgency to speed up the process and improve things fastly, because if you are cancer patients today, you cannot wait until next year or the next month for the next legislation to take place. So there's a real urgency to get going and to provide solutions today.
Thank you, Oliver. And that will take me to the third dynamic in the European health policy space, which is the European health data space. What would be your reflection for this one, and what would be the impact on our patients and our healthcare systems in Europe?
Yeah. We have been discussing the value of science, the breakthrough that we see in technology. And so for sure, data and analyzing data and bringing data together is a key component in making healthcare systems more sustainable, better, and also a key component for advancing science. We know this from the countries in the Nordics, for example, being able to analyze the data just to route effective therapy interventions much better. Learn quicker, throw out things that don't work, bring in things that work very well. And I think that's a key for a more sustainable healthcare system. From a patient level, it also helps to get the most effective therapy quicker. Imagine if you, with your cancer diagnosis, you would be able to, get all the insights that you have from a similar patient group in Europe or elsewhere in the world, and understand very early on, here could be a treatment strategy that works for you most effectively. So I think here, having the space, European health data space, anonymized data for clinicians, researchers, and industry to assess and bring forward the insights to development, but also to better patient care, I think is a key component that will help the European health to be in a better and healthier state.
As we are approaching the end of this episode, let's please hear your final remarks, your final reflections, and let's be very concrete about the current state and challenges, the vision for the future, and how we are going to address that today, because you said that this topic is really time sensitive.
Yeah.
So let's hear your final reflections, please, Oliver.
Yeah. So I think we talked a lot about the challenges, also, in some parts of the healthcare system, the crisis that we are facing. So taking this very seriously, let's look at the opportunity that we have with the policies. These are crucial elements to expand patient access and to accelerate innovation and innovation delivery along the way. We can bring in our partnership and our expertise, like many others, in our 125-year history, bringing curative medicines, breakthrough medicines, diagnostics, our understanding of data. So it's a call to partnership working together towards the bold vision of a better health state. And we do need to see from governments and regulators a strong commitment and investment towards innovation moving forward. If we do this together, I'm very positive we can get to a future health state in Europe where we focus our energy on staying healthier for longer and have freeing up funds from sick care and help patients to live a longer and better life.
Thank you so much, Oliver, for the insightful discussion. And indeed, also we are on a burning platform. There is a real concern and challenge today in terms of our healthcare system in Europe. But together, through partnership and collaboration and a real bold vision for the future, where healthcare innovation is being assessed and rewarded timely in Europe, we will establish Europe as a hub for innovation. We will have a more sustainable healthcare system. And finally, we will have a better outcomes and care for our patients, because healthcare matters.